Somatic symptoms and dissociative disorders are some of the most difficult disorders to treat. Somatic symptom disorders used to be known as somatoform disorders. These are a group of conditions that involve physical symptoms combined with abnormal thoughts, feelings, and behaviors in response to these symptoms. There's a disorder called factitious disorder where the person intentionally produces psychological or physical symptoms, or both. The typical profile of this person is someone who receives some reward from playing the sick role. There is some external incentive, such as attention, missing work, avoiding military service, or even trying to avoid criminal prosecution. Another disorder within the spectrum is called hypochondriasis, better known as a hypochondriac. This person is preoccupied with either fears of contracting a serious disease or with the idea that of having the disease even when they don't. There's a lot of complaints and misinterpretation involved with this disorder. For example, if someone has a headache, they are convinced that they have a brain tumor and they will go to every doctor until they've had every test run and someone finally gives them a diagnosis. One of the most prevalent cases is called Munchausen's syndrome by proxy. This is a fictitious disorder imposed on someone else. The person seeking medical help or mental health professional help has intentionally produced a medical or psychiatric illness in someone else that is in their care. This really came to light when a woman named Kathy Bush had her 8-year-old daughter in and out of the hospital for a variety of issues, resulting in 130 hospitalizations, 40 surgeries, and over $3 million in medical expenses. When her daughter was removed from her care, she improved, but when mom would come and visit, the daughter would get worse. The other part of this chapter is about dissociative disorders. They used to be called multiple personality disorders, where a person splits from their normal functioning. Dissociative disorders are a group of conditions that involve a disruption in the person's normally integrated functions of consciousness, memory, identity, or perception. This is much more than driving to a location and not being able to remember how you got there. A stressful event typically triggers a dissociation from the host self. The person usually has 2 or more alters, or alternative identities. Both of these disorders can be difficult to treat because of the complexity of the illness and our own views of mental health. We really have to examine whether or not the person involved is really mentally or physically ill, or if that behavior is serving a different purpose.